With clinical pathways, we could potentially utilise that better to minimise the variation in patient care, ensure that any health inequities are minimised. I'm Associate Professor Viet Tran. I'm an emergency physician at the Royal Hobart Hospital, Foundational Director of the Tasmanian Emergency Medicine Research Institute and Emergency Medicine Discipline Lead at the University of Tasmania. So when I started as the Director of Emergency Medicine Research with the Tasmanian Department of Health in 2019, there wasn't much happening in the space of emergency medicine and for research. And in particular, if you think about emergency medicine as a specialty, it's actually quite young. We're one of the youngest specialties internationally, and in fact, some countries still don't see emergency medicine as a specialty in its own right, unlike things like cardiology, where they've got 400 years ahead of us in terms of being a specialty and having the research infrastructure and the research to go with it. So when you have a look at research for emergency medicine, we're still in our infancy and we're still trying to find our feet. And certainly that's the case within Tasmania as well. And so what we found was to be able to enhance our research footprint, that we would collaborate, and we have collaborated nationally to enable us to tap into some of that research that's happening in emergency medicine around Australia. The two big ones that we've been collaborating with that's really helped launch emergency medicine research in Tasmania has been through the Predict network with Professor Simon Craig, who has been instrumental in helping to foster that research infrastructure in Tasmania, as well as through the National COVID Research for ED with the help of the Alfred Emergency Department, led by Associate Professor Gerard O'Reilly, has been the other big factor with regards to building our research capacity in Tasmania so that we can fulfil the requirements to deliver high quality patient care. The current biggest study that we're involved in is an MRFF study looking at the implementation of clinical pathways in Tasmania. That's an MRFF grant over 5 years. The premise of the research for this grant is around the fact that we know that roughly it takes about 17 years to get evidence developed at the bench side or published in papers to get to the actual bedside and actual patient care. It takes about 17 years. And what we wanted to do is understand how we could reduce that time from research publication to actual impact at the patient bedside. And to do this, we thought that emergency medicine has a different flavour when it comes to research. We have high patient numbers. We have we hopefully only see them for a short period of time, and we often don't have that opportunity for follow-up as well. And so what we found is that with clinical pathways, we could potentially utilise that better to minimise the variation in patient care, ensure that any health inequities are minimised, such as rural and regional ED settings, and trying and understand why pathways may or may not being used effectively from that point of view as well. The reason why this all started in the first place was the fact that we found, and this is internationally, that perhaps clinical pathways perhaps aren't used as often as we would like them to be used, and therefore that introduces variation in care, and it certainly introduces some safety concerns as well if we're not following the right pathways within our own evidence-based practice. And in Tasmania, what we found is that perhaps around 10% of pathways were being used, which raises the question of what's happening with the other 90%, but even more so, why are we only using it 10% of the time? And so our research is looking at the why, but also developing an implementation toolkit to increase that uptake of clinical pathways so that every patient in Tasmania can have the same standard of care regardless of which ED they turn up to. And hopefully with the lessons learned from our projects, we'll be able to teach other sites with similar sizes and similar patient cohorts how to effectively implement pathways and other projects in their jurisdictions as well. For our major project that we're performing at the moment, we sought funding from various bodies, and we were lucky enough to be successful after a grant application to the Medical Research Futures Fund, which is one of the largest Australian government-led research funding rounds in Australia. And from that, we were able to secure $2.7 million over 5 years. For me, emergency medicine research forms one of the 4 key pillars to delivering high quality patient care. These pillars are research, education, quality, and safety. And so with research, what you have is being able to answer how or what high quality care is. The education is about how many people can deliver it, whereas quality is about how systems can deliver what the research has shown. And then safety is about how systems can minimise the harm provided if the right context isn't applied for application of that research. And so for me, my journey started in education and quality and safety, and it quickly was obvious that it was not a stable platform to deliver that high quality care that I've been in pursuit of. And so by understanding that the research side of things and developing the research and essentially the research impact has really fostered my passion to enhance not only research capabilities, but research understanding and evidence-based understanding for all clinicians, both within emergency medicine and without. Outside of work, I have a wife and 4 children, and living in Tasmania, that gives us the opportunity to do plenty of things in the outdoors. So weekend hikes, we live near the beach, so we spend most of our time there. And if you ask any 4-year-old, they do not feel the cold at all. So being in Tasmania on the beach or even in the water in the winter is certainly not a barrier for any of my kids. And so we spend a lot of our time in the outdoors and just being able to reset and re-energize so that I can give 100% to my work when I have to go back.